Hello, I'm Marcus Fairley, and this is my research presentation. Okay, so quantitative versus qualitative. So my study, it's based on the analysis of the effects of weight loss, and for the quantitative measure, one can examine the changes of weight after weight loss strategy is applied to a certain group over weight loss or overweight slash obese participants over a period or course of time. For qualitative research, one could explore or examine participants' opinions and concerns towards specific weight loss strategies. Reduction in obesity and related comorbid conditions after diet-induced weight loss or exercise-induced weight loss in men. Okay, so the purpose of the study was to investigate the effects of diet-induced versus the exercise-induced weight loss in men. Um, it was based on the reduction of weight and was observed in the diet and exercise of weight loss groups. Cardiovascular fitness improved in the exercise groups by 16%. The exercise weight loss group experienced greater average of fat, um, especially within the abdominal and visceral portions of the body. This fat reduction was 1.3 kilograms compared to the other diet groups. There were no changes in plasma volumes or glucose insulin values that were observed among the experimental and control groups. Similar improvement on glucose disposal among the weight loss groups was also noticeable, and there was improvement in but there was significant different results coming from these control groups. The independent effects for the diet or exercise-induced weight loss on the reduction of obesity and related comorbid conditions are not known. Okay, so my next study was the diet-induced weight loss, exercise, and chronic inflammation in older obese adults, and this is a randomized control clinical study or trial. And the purpose of this study was to determine the effects of diet-induced weight loss and exercise on the markers of chronic inflammation. Diet-induced weight loss intervention resulted in considerable improvement in concentrations of C-reactive proteins, interleukin-6, and soluble tumor necrosis factors alpha receptor 1. Exercise training did not demonstrate a significant effect on the reduction of chronic inflammation markers. Dietary intervention for weight loss also contributes to overall reduction of inflammation. Additional studies with larger sample sizes are needed to explore the possibility of sex and race differences in the response of these inflammatory biomarkers to weight loss. In addition, more trials are needed to assess the effects of different modes and intensities of exercise on inflammation. So my next study was weight maintenance and relapse in obesity, and this was a qualitative study. The purpose of this study was to investigate psychological factors among women that influence the maintenance of weight loss versus weight regain. Psychological factors associated with regaining weight um, can be all examples include failure to achieve weight loss or weight goals, dissatisfaction with the weight achieved, tendency to evaluate self-worth in terms of weight and body shape, lack of weight vigilance and control, dictamous thinking or morbid thinking styles, and the tendency to use eating to regulate mood. Psychological factors were not identified within the weight maintainers group, and the psychological factors presented in the study need to be further studied. A qualitative study is needed to better the quantity influence of those factors on one's ability to maintain their weight following a weight loss program. Comparison of the next study I chose was comparison of weight loss diets excuse me, with different compositions of fat, protein, and carbohydrates. The intent of this study was to analyze long-term effects of three principal dietary macronutrients. After 6 months trial, participants had lost about 7% or 6 kilograms of their initial weight. By 2 years of the trial, weight loss remained similar among the groups. The average weight loss at the end of the trial was 4 kilograms, which was about 14 to 15% of the participants that they had a reduction of at least 10% of their initial body weight. Reduced calorie diets resulted in significant weight loss regardless of which macronutrient constitution. The findings provided in this study can be directly applied for clinical recommendations for weight loss individuals and the development of population-wide recommendations by public health officials. Diets that incorporate a range of fat, protein, and carbohydrates can reduce risk factors for cardiovascular disease and diabetes. Such diets can also be personalized for each patient based on their preferences and still generate high chances for long-term weight loss. My next study was diet-induced weight loss improves not only cardiometabolic risk markers, but also markers of vascular function, a randomized controlled trial in abdominally obese men. This study investigated the influence of diet-induced weight loss treatment on the risk markers for cardiometabolic disorders. Results have shown that diet-induced weight loss is directly associated with significant improvement of risk factors related to the cardiometabolic health. Such improvements relate to the beneficial effects of weight loss observed on visceral fat volume, blood pressure, serum lipids, and plasma glucose. At the end of the study, cardiometabolic risk profile from the diet-induced weight loss program was compared to the normal weight men. This discovery has the potential to underline practical relevance of waist cutoff value in the diagnosis of metabolic syndrome. More investigation is needed to examine the long-term effects of the extrapolate the findings, and to extrapolate the findings to women. My next study was called the effect of a lifestyle intervention program with energy restricted Mediterranean diet and exercise on weight loss and cardiovascular risk factors. 1 year results of the pre-Metaplus trial. I apologize. The object of this study was to analyze long-term effectiveness of intensive weight loss lifestyle on cardiovascular prevention. After 12 months, participants lost an average 3.2 kilograms. Cardiovascular risk factors significantly improved experimental group in comparison to the control group. Participants with pre-diabetes or diabetes, full-blown diabetes, significantly improved glycemic control and insulin sensitivity, as well as triglyceride and HDL cholesterol levels compared with the control group. Intensive weight loss lifestyle showed significant efficacy on reducing fat and improving cardiovascular risk factors in overweight, obese adults and metabolic syndrome and a risk for diabetes. My next study was called College Students' Barriers and Enabler for Healthful Weight Management and this was a qualitative study. The study aimed to identify barriers and enablers for healthful weight management among college students. Barriers to weight management included intrapersonal, which would be more of a temptation and lack of discipline, interpersonal, which was seen as social situations, and environmental, which could be time constraints or ready access to unhealthy food. Enablers to weight management, from an intrapersonal perspective, showed regulation of food intake, being physically active, interpersonal, which showed social support, and environmental, um, which was the university's environment support, which included physical activity. College students were more sensitive to barriers than enablers of weight maintenance, and individually, this study focused on interventions, and they must be applied in conjunction with environmental interventions to facilitate behavior change among college students. So my next study was called A Qualitative Study of Factors Affecting Pregnancy, Weight Gain in African American Women. The objective of this study is to further understand the barriers and enablers for healthy weight gain during pregnancy in overweight and obese African American women. Less than 50% of the women believed that they would gain weight in excess of the range recommended by the Institute of Medicine. Participants were motivated to exercise, aiming personal health benefits. Barriers included safety concerns for the fetus, cravings readily available to unhealthy food, and so on. Interviews covered numerous misconceptions and barriers. They need to be further investigated to develop more efficient intervention messages and strategies. My next study was called The Effective Diet and Controlled Exercise on Weight Loss in Obese Children. And the objective of this study was to analyze the effects of adding exercise to diet-induced weight control in obese children. Significant weight loss was observed during the treatment for every participant. Children who were subjected to an exercise regimen experienced a longer and lasting weight loss period. Significant increase in fitness was observed among the children in the diet and exercise-induced weight loss groups. My next study was called Intermittent versus Daily Calorie Restriction, which diet regimen is more effective for weight loss. The purpose of this study was to examine the different effects on weight loss caused by daily calorie restriction versus intermittent calorie restriction diets. Participants demonstrated similar weight loss, fat mass loss, and lean mass retention between both groups. Intermittent participants lost less fat-free mass in comparison to daily restriction group. Overall, the daily and intermittent calorie restriction diets have similar effects on decreasing body weight and fat mass. Intermittent caloric restriction diet may be more effective or more efficient on retaining lean mass. And these are my references. Thank you.